Dear friends, today we are going to discuss about one of the marmas in the upper extremity. The important marmas in the upper extremity, one of them is ani marma. So, my topic of discussion today is the ani marma. Ani marma is a snayu marma or a ligamentous marma, we can call it. The width of this marma is ardh angul. Ardh angul means half finger unit. So, when we are defining about finger unit, there are various ways in which our acharyas have defined about finger units. One of the ways is of the measurement is you can close these four fingers, take it like this, okay, and measure the base of the four fingers, okay, and then divide it by 4. So, that constitutes one finger unit. So, when I am saying that the width of the ani marma as described by Acharya Sushrut is ardh angul or half finger unit, okay. The site of ani marma is 3 finger breadth above the elbow or kurpar. So, ani marma is a vaikallikar marma. That means, if there is severe trauma on this marma, then it can be disability causing marma. There can be blood loss or the functions of the elbow joint is restricted, especially the extension and inward movement of the elbow joint like this. If you want to rotate it, then that movement is restricted if the ani marma is injured. If a patient is already having some pain in the elbow joint, for example, golfer's elbow and restricted range of movement where post trauma some patients have a supracondylar fracture of humerus and they put it in the cast, and after removing the cast, after the fractures have healed, then there is generally a stiffness in the elbow joint. So, in such cases we can stimulate the ani marma for better or early recovery from the joint stiffness. We also use this for tennis elbow cases, also where there is muscle wasting in the arm. So, we can use it there. Then we also use it in cases of bicipital tendinitis. So, as you can see, the application of ani marma is a lot. So, we must know how to stimulate the ani marma. In Ayurveda, it is said that ani marma controls the udakavah srotas, and it also controls the function of the kidneys. So, in such cases where our kidneys are affected, then for better renal outflow, the ani marma is to be stimulated. Now, we will discuss about how we can stimulate the ani marma. So, first of all, you have to expose the elbow joint and locate the elbow crease. So, this is the elbow crease here, okay. So, I will take a marker and mark it on my elbow. So, you draw, this is the elbow crease, you fold, flex and extend, and then when you flex and extend, there is a fold where you have to mark. Then you draw a line like this in the center of the arm. Friends, you can see how I have drawn the line, okay. So, this is 3 finger breadths above. So, the ani marma lies on the medial side. So, this is the internal side or called as the medial side of the body, okay. So, 1 finger breadth medially. So, this breadth here is 1 finger breadth, Okay. So this is 1 finger breadth, and this length is this area. From this, if you draw a line like this and like this, so this is 3, okay, and this is 1. So this is 1 finger breadth, as you can see, and this is 3 finger breadth. So this is the site of the ani marma. So now you can locate it on your own. Good. So once you have located the ani marm, then we need to know how we stimulate the marma. So then you will put your 4 fingers and hold the arm like this. And then with the help of the pulp of the thumb, this area, we will stimulate the ani marm like this. Okay. Now how much pressure here is to be applied? Then again here also we need to apply moderate amount of pressure. It should not be too hard, should not be too less, because it is a snayu marma. So this is the way of stimulation. Again, when you are stimulating it, you have to know that the palm should face upwards. So like this. Now where the direction of pressure is to be, that also we should be very clear about. It should not be downwards pressure. It's not like this, we go downward, no, and not exactly posterior, not like this. You make an imaginary line here in the center like this, okay, and this is the point, you will apply pressure towards. So from this point to this point, make an imaginary line and then apply the pressure like this. Okay, press and release, press and release. Again, press when you are exhaling, release when you are inhaling. Okay, press when you are exhale and release when you inhale. How many times? 20 to 25 times. So the overall time taken is approximately 75 seconds. One press and release takes approximately 3 seconds. So now we will learn about the technique of stimulation of ani marm on our patients. This marma is closely related to the biceps muscles, the coracobrachialis muscle, and the median and ulnar nerve, and also the brachial artery and vein. I will hold the palm with one hand, or the wrist with one hand like this here, and then put 4 fingers in the back, and with the help of the thumb, okay, we place it finger like this and then press. So a moderate amount of pressure is to be applied here. Press and release, press and release. Now which direction the pressure is to be applied? Again, you have to draw an imaginary line on the back. From the elbow you make an imaginary line on the medial side, or on the middle side rather. So this is an imaginary line, and make a imaginary point here. Okay, so this is an imaginary line and an imaginary point. So from this point to this point, you will apply the pressure. Press and release, press and release. It hardly takes 1.5 minutes to stimulate one side of the ani marm. Similarly, you can do the other side of the hand. There are 2 ani marmas in the upper extremity and 2 in the lower extremity. The lower extremity ani marm identification and stimulation we will discuss in our next presentations. Thank you. Thank you.